We have breaking news from a small town of Sammamish, Washington. Tuberculosis has made itself known. Let's take a look at a recent case being studied from the beginning.
Well, I've been super busy with lacrosse, and I have been spending a lot of time with my teammates, and some of them are experiencing a chronic cough. I want to play my best for this season, and I don't want to be sick. Can you test me for anything that rings a bell having to do with a chronic cough?
One thing does come to mind. I'll test you for tuberculosis due to chronic cough, which is a common symptom.
Well?
Multiple tests, and it appears as though you have latent tuberculosis.
Oh no!
It's a good thing you came in, because tuberculosis is still dormant and we have treatments.
What even is tuberculosis?
My assistant can answer all your questions. I must go help other patients.
Hi, Mar. Tuberculosis is an infectious bacterial disease and is called tuberculosis because it affects the growth of nodules, tubercles, in the tissue, specifically the lungs.
What are the symptoms?
There are many symptoms, such as pain in the chest that occur while breathing, chronic coughing, coughing up blood. Regarding the whole body, you can experience fever, loss of appetite, night sweats, fatigue, chills, loss of muscle, swollen lymph nodes, phlegm, shortness of breath, and unintentional weight loss.
Wait, is this all going to happen to me?
No. Since you have latent tuberculosis, the bacteria is dormant.
Why is it dormant?
It's dormant because your immune system is so strong. It only becomes active when the immune system is weak, which is a large reason why those with HIV or elderly are likely affected.
That leads me to my next question. Who all is mainly affected?
Almost anyone can be affected by tuberculosis, but lots of active young adults are affected because they come in contact with so many other people. People infected with HIV or have an infection that impairs the immune system is 26 to 31 more times likely to get tuberculosis. Also, over 95% of cases and recorded deaths occur in developing countries. But this does not mean you're safe. Even if you do have HIV, you are also in danger. In 2013, over 500,000 children were diagnosed with tuberculosis, and of those, 80,000 passed away. This disease is the second leading cause of death in young adults.
What is tuberculosis' global impact?
Tuberculosis occurs in every part of the world. In 2013, the most accounts of the new cases occurred in Southeast Asia and Western Pacific regions, made up to 56%. However, 86% of reported tuberculosis cases happened in 22 countries in 2013. The good news is that most countries are experiencing some kind of drop in the number of cases, whether it be gradual or drastic.
What about the history side of things?
Laura Lee has you covered there.
Not too much pure history when it comes to tuberculosis. Besides, it was discovered on March 24th, 1882 by Robert Koch, a German physician and scientist. Like Hannah mentioned, the amount of tuberculosis cases has mainly gone down, but mainly in US-born people and has constantly gone down since 1993. However, among foreign-born people, the number of cases is about the same each year. This is because of the medicine for tuberculosis is fairly expensive, and those in third world countries cannot afford the proper treatment. During the last decade, 90 million new infections have occurred and 30 million have died.
I got from a girl on my lacrosse team. She had just been to Africa on a tourist vacation and must have been consuming unsanitary food and liquid. Can you explain to me the biology side of tuberculosis?
The pathogen is known as Mycobacterial tuberculosis, which is a rod-shaped bacteria. The host itself is you. When active, it eats what it wears. If tuberculosis is not properly treated, it can evolve into a multi-drug tuberculosis, which means some tuberculosis germs are resistant to certain drugs, which makes it more difficult to treat. Tuberculosis can take it a step further and develop into extensively drug-resistant tuberculosis, which is resistant to the same drugs as multi-drug tuberculosis and more, which makes this medicine extremely expensive.
Can you tell me how Dr. Kate was able to diagnose me?
Dr. Kate was able to identify you had tuberculosis or not by either a blood test or a skin test. If positive, she will get an x-ray of your lungs and a sample of sputum that tells us if tuberculosis is latent or active.
What would my x-ray look like if I had active tuberculosis?
Well, it would have little dots that appear white on the inside of the lungs.
Does tuberculosis only disrupt the lungs?
Actually, no. It can also affect the heart, bones, digestive system, spine, urinary system, and the kidneys. Due to all these cumulative risks, this causes person's homeostasis to be unstable.
What is the role of the immune system when it comes to this disease?
Well, if you have a strong immune system, your body would probably fight it off, but if it is weak, then lots of drugs come into play.
What can weaken my immune system?
Lots of things can weaken your immune system, such as not getting enough sleep, not getting enough vitamins, partying too much, using drugs, drinking, smoking, stress, poor housing. Long-term illness, it depends.
What will my immune system do when affected with tuberculosis?
The body detects the invasion, sends out the first line of defense, known as alert signal security steps, self versus non-self, which are macrophages, which engulfs the microbacterium and transports them to the lymph nodes in which they are neutralized. So if neutralized, the person will have a latent tuberculosis. However, in the 5% cases that the immune system is overwhelmed, the microbacterium escapes and the person will fall ill. In other cases, the latent tuberculosis can wake up and become active. This can happen months to a year later. Once active in the lungs, it can spread through the body using the bloodstream.
As you can see, this is what Mariana's lungs look like. You can see that she is breathing in the bacteria Mycobacterium tuberculosis. The tuberculosis bacteria are the orange dots as you can see in the video. This is a big picture of what's happening, but let's look at a closer view of what's really happening inside her lungs. Well, first, the body detects the invasion and sends out its first line of defense, which are the macrophages. They are the blue dots. B cells also come into play, but however, since Mariana has latent tuberculosis, you can't see them now because they are not needed, because tuberculosis is not active and is not hurting the body. The B cells would be the green dots if Mariana had active tuberculosis. However, since this is a case of latent tuberculosis, macrophages can easily engulf the bacteria before it hurts Mariana. But somehow, if the macrophages miss some of the tuberculosis bacteria, it is too late for the immune system to fight back because the B cells did not memorize the bacteria. The immune system can soon be overwhelmed by the bacteria and all lines of defense are useless.
Well, if tuberculosis is able to spread to the kidneys, brain, or heart, it can cause mass disruptions and it kills people. When having to do with the lungs, tuberculosis gets into the cycle constantly, seeding and overworking the lungs, and the victim eventually dies.
How can I prevent the spread of tuberculosis?
When coughing or sneezing, do it in your sleep. Stay out of dangerous environments. Avoid going to work, school, sleeping in a room with other people. Opening windows to ventilate because tuberculosis spreads much faster in enclosed areas. Wear a mask if going out to public places for the first 3 weeks of your treatment. You can also get the vaccine, but in recent studies only protects you when you are younger, not when you are older. If it is not used very much in the United States, but mainly in poorer countries, on infants.
How can it be treated?
There are 4 main drugs to treat tuberculosis.
Isoniazid, rifampicin, ethambutol, pyraminazide.
If you have a multi-drug tuberculosis or intensively resistant tuberculosis, you will also be given
Amikacin, kanamycin, capreomycin.
that are generally taken for 20 to 30 months. Some new drugs are being discovered as add-on therapy for drug-resistant tuberculosis, which includes
Bedaquiline, Delamanid, PA824, linezolid, Sucilid,
Since you are taking these for a long time, it is important for you not to skip any medication if you're feeling better.
Wow, that's a lot to take in.
Here's an overview. 1/3 of the world's population is infected with latent tuberculosis, and only 5% become active. The key differences between latent and active are latent has no symptoms, does not feel sick, cannot spread, normal chest x-ray, negative septum smear, whereas active tuberculosis has many symptoms, usually feels sick, and has a positive spectrum smear. The United States born rate of cases has gone down. Sorry about that. Over time, while foreign-born stay at the same rate each year. And even if you're feeling better, do not skip on medication early.
Wow, thanks.
See, even you can prevent tuberculosis, just as Mariana is taking the steps to help prevent and live tuberculosis free. I'm Ashley Wozniak, and that's all we have for you this afternoon. Have a great day.